Hello David, Martha and Ivy, how has the week been?
We have been giving Ivy more food as you suggested, but Ivy is finding it extremely difficult to eat.
She complains that her stomach really hurts and she feels bloated all the time.
Mom, I just can't eat all that food. My tummy hurts all the time, and I feel bloated.
This is a very common problem. Let me explain. Your digestive system is a very complex system and is made up of organs such as your stomach, the small and large intestine and many others. When people don't eat sufficiently for a long time, the organs slow down, and the muscles in those organs become weaker, just like the muscles in your legs and arms lose their strength when you don't use them.
I didn't know I had muscles in my digestive tract.
Not many people do, and usually don't even think about it. It's only when your digestive system doesn't work properly that we become aware of it.
That's very interesting.
Yes, it is the muscles that push food through your digestive tract. If you don't eat sufficiently, there is not much food to push through and everything slows down and becomes less efficient. Your stomach also shrinks.
And how does that cause the pain?
When you can't push food through, it sits in your stomach for longer and makes you feel bloated. You may also experience constipation because your large intestine is also weak. As we increase the food, your stomach also has to stretch to return to its normal size. All these things are probably causing your pain and making you feel bloated.
Will it go away?
Yes, after several weeks of normal eating, it should resolve itself.
Ivy also complains of reflux.
Mom, it's all that food you make me eat. My stomach is so full that it comes up my throat.
This is also another common and uncomfortable symptom that adolescents experience when they start eating normally.
She complains about that a lot. We don't know if we should keep pushing the food or give her medication for it.
Ivy's reflux is very different to the normal reflux many people experience after eating rich and spicy food, which is called acid reflux. Ivy's reflux is because her food sits in her stomach for longer, and sometimes it feels to Ivy that it comes up her esophagus. Again, the best thing you can do is to keep feeding her the quantities she needs and allow her digestive system to get back on track.
So you are saying that at the moment, we just ignore these symptoms and keep feeding her?
Yes, if she did not suffer from any of these symptoms before she developed anorexia, they are probably a symptom of food restriction and the anorexia, so it's best to aim at getting her weight restored and they should resolve very quickly. You can also discuss them with your pediatrician.
I am really trying, but it's not getting any better.
Ivy, I understand how uncomfortable this must be for you, but you have just started treatment, so we need to give your body a chance. You need to trust Mum and Dad that they know what they are doing.
Is there anything we can do to make her feel more comfortable?
Yes, some adolescents tell me they find comfort from putting a heat pad on their stomach.
I wish we had known all this earlier.
Starvation has a huge impact on the digestive system. You need to remember that all the normal connections between the brain and the digestive system have become dysregulated. The parts of the brain that control appetite and fullness are probably not functioning so well, so it may take a little time to re-establish all the brain-stomach connections. The quicker Ivy returns to regular eating with the appropriate quantities the body needs, the quicker she can re-establish those connections.
Knowing this makes us feel less worried and more comfortable to keep feeding Ivy the large amounts we need to feed her. Don't you agree, Martha?
Yes.